some topics that are relevant that we want to share with you all. And we want to thank the Queer and Ally Student Assembly for collaborating with us. And we also want to mention that Unmasked previews Mental Health Awareness Month, the first one ever at USC, which begins on October 12th. So we're going to preview that as well. So we're previewing a lot of things. So without further ado, I'm going to introduce our two moderators today, Hannah Nguyen, who is the director of ACA, and Albert Chang, who is the AD of QUASA.
Hello. As Louise said, my name is Albert. I'm the assistant director of QUASA.
And I'm Hannah, the director of the Academic Culture Assembly. Before we hop into the panel, I just want to let everyone know that Elise and Bryce are here from USC Counseling Services and will be available after the event if you need anybody to talk to. And they also brought brochures from the Counseling Center up at the front by the promo items. Jenny is holding them up. If you'd like to come after and pick one up if you have done so already.
Cool. So without further ado, we're going to go ahead with the panel. So if you'd like to introduce yourself, your name, your pronouns, are you a student? And then can you describe your work or activism and also how it applies to mental health?
Okay. All right. Okay. Yeah. Can y'all hear me? I feel like this microphone isn't turned on.
You can pull it closer.
Okay. Cool. Okay. I'm Ryan. My pronouns are they, them, theirs. I'm a current third-year student studying fine arts at USC. Right now, my main activism-y type work is I'm co-founder and co-president of the Transgender Advocacy Group here at USC. And it might seem like a bit removed from mental health, but I think that having a group specifically for trans people who are like, it's really difficult to find like a good trans community, and a lot of trans people feel super isolated, and just like the act of like creating that community and like creating a place where like trans people can like go to like feel loved and like accepted and like seen for who they are, I think is really important to mental health.
Hi everyone, my name is Diego Sepulveda. Well, my name is Diego Sepulveda. I did my undergrad at UCLA. I graduated in 2012, and I'm currently getting my Master of Business Administration, and it's specialized in nonprofit management. I currently work at the UCLA Labor Center, so I'm a project coordinator. We do a lot of work around wage theft. Specifically what I do, I was brought on to coordinate alumni for our national internship program. We now have about 500, so really the internship program is about empowering immigrant youth and allies to move forward in their professional and leadership affairs. So that's what I do at the UCLA Labor Center, and what really sparked a lot of my advocacy was that I used to be undocumented and LGBT, so growing up, the idea of college, the idea of even mattering in society was really out of my own scope of thought, just based on what I heard on the news and everything that I saw on TV. So really, it's been a process of love, of self-discovery, and really empowerment, finding voice within my lived experience, and really that empowers a lot of the work that I do now with LGBT youth, with workers, with, so a lot of the work that I do.
I'm Eli, and wow, this microphone is really quiet. I'm a queer trans woman, and I'm the director of Trans Student Educational Resources. At the moment, we are the only national organization run by trans youth, also the only national organization for trans youth. And so while this is also very sad, it's very empowering and inspiring to see all of these young people working together. We're all students, and many of us have faced mental health issues, which has really shaped our experiences. And also, these experiences haven't been particularly unique either, because the majority of young transgender people do experience mental health issues within just their K-12 schooling system. along with this, I am also a National Advisory Council member for GLSEN, the Gay Lesbian Straight Education Network, and a Youth Advisory Council member for the Trevor Project, which is a mental health and suicide prevention organization here. I'm based in West Hollywood.
Awesome. Thank you so much for introducing yourselves. I'm just going to introduce myself again. My pronouns. My name is Hannah. My pronouns are she, her, hers. Sorry I didn't do that previously.
Albert, him, his.
And so I know each of you touched upon this briefly in your introductions, but if you could each kind of expand upon what you talked about and discuss more about what you feel are the unique challenges to mental health that LGBTQ folks experience. Yeah, we can start anywhere.
Okay, I'll volunteer to tribute this time. So when we're talking about mental health, we're not just talking about one group of people. We are talking about so many different factors affecting people, which is why we must, when addressing mental health issues, we must address the most marginalized people, particularly people of color, trans people, undocumented people, and those who are facing oppression in multiple areas. And we have to do this because all of these areas come together and affect people in and marginalize them in ways that may affect their well-being and thus affecting their mental health as well. All of my experience has been growing up. I mean, my experience with mental health has been growing up with. Being a queer transgender girl, I came out at the age of 8 in an extremely rural community that wasn't ready to support me in 2003. I'm sure most people here are from the city, and so that might not resonate with too many of you. But experiencing isolation as a queer person, as a transgender person, is something that many people can relate to, and it's something that does trigger mental health issues in so many youth, even today.
For me, growing up, I felt like I always inhabited a double closet. So growing up, I saw my parents working in factories because they weren't documented, and I thought that's what I was going to do. So a lot of education for me didn't matter up until middle school, high school. I got straight D's and F's. And my teachers were like, "Oh, you don't do your work, but some of the work that you do turn in is actually pretty great." Let's try to dig deep on that. And I had never told anyone that I was undocumented. And it wasn't until 10th grade that I told one of my teachers, and my teacher told me, "You are not your circumstance." And for me, I'll never forget those words, and those are words that I used to be able to move forward with my own development of being undocumented, understanding that I lived in this country, but it didn't see me as someone that mattered or someone that existed, and I was discriminated against all the time. My mom would tell me, be careful on the streets, because if immigration comes or police comes and they start asking you questions, then you could potentially be deported. And that's a reality that the undocumented community lives with. It's the reality that at any point you could be separated from your family. And growing up being LGBT, I didn't know that I was gay, but apparently my brother knew, my classmates knew, everyone around me knew. And I was just like in the state of oblivion that I just didn't get it. And it wasn't until I left high school that I really started exploring that side of me, because I was coming to terms with being undocumented. And then when I went on to college, onto the college scene, I saw people expressing themselves, and I saw people who were just comfortable in their skin. And I was like, oh, that's me, that's me, that's me. And then I started piecing it together. And then I met this boy, and we had a thing. And he's like, oh, do you want to come pick me up? And I was like, I don't drive. And then the reality of being in that relationship or dating someone was that, okay, cool. Now I get that I'm gay, but you don't know that I'm undocumented, so you don't know that I actually can't drive because I can't get a driver's license. And I can't work to take you on a date because I can't legally work. So navigating that experience my entire life really kind of propelled me to do a lot of work. When I arrived at UCLA, I realized that there weren't a lot of scholarships for undocumented LGBT people. So I partnered with people in the community and the Los Angeles LGBT Center and Congresswoman Judy Chu, and in 2009 we put on the first ever undocumented LGBT fundraiser, and we fundraised like about $8,000. because we realize that LGBT folks and undocumented folks, they're on our college campuses, and we need to be able to support them. I was like, I need to stay on this campus, so what do I do to like survive and self-advocate? And we embarked on hunger strikes for the Federal Dream Act that would provide us a pathway to citizenship. And then I was like, I need to take this to the national level, so I joined the United States Student Association Board of Directors. I was the National Queer Student Coalition Chair, so really represented like 4+ million folks nationwide, college students. And a lot of this work led me to working with nonprofit organizations. So right now there's a big push for Health for All, which, so there are 1 million undocumented folks here in the state of California that don't have access to health care. Those are people like my parents, that don't have that access. So what I ended up doing along with Victoria is we went to Sacramento and we advocated for Health for All. So I partnered with Equality California and we launched this Health for All campaign where I talked about being undocumented, being LGBT, and not having access to a lot of these different resources. Luckily, I was never bullied throughout high school or in my community, but I know a lot of people really close to me who live in East LA and who were beaten and and they had to seek refuge. And just being undocumented and being LGBT, knowing that you're disproportionately facing a lot more obstacles when it comes to even just talking to the police or facing violence. So okay, I'm undocumented, this just happened to me. I want to go to the police, but I know if I go to the police, then they're going to ask a lot of questions. And then there's a partnership between immigration or ICE that if they find out I'm undocumented, I could be deported. So for the undocumented LGBT community, a lot of it is, well, I want to be able to go to police, but there's this distrust. And then once I do go to the hospital, I don't qualify for health care. So then I'd have to go to an emergency, and then that's a big bill in and of itself. So it's always this battle as an LGBT identified individual. It's like, do I have access to health care? Do I have access to services? And once I have access to them, are they culturally sensitive? And do they understand where I come from? So a lot of my work really kind of came to a culmination where I was a consultant for a nonprofit organization called Latino Equality Alliance and partnered with the Los Angeles LGBT Center. And we opened the first Mi Centro LGBT in Boyle Heights. So it's the first ever LGBT center for youth in Boyle Heights and surrounding communities. So a lot of it is really building sustainability and making sure that our youth have resources in and out of school. Sorry, that was a lot.
It's all wonderful. So I'm not only trans and queer, I'm also mentally ill. I have bipolar disorder, which started manifesting when I was about 13 years old as really bad depression, which coincidentally coincided with when I started realizing that I was maybe not straight and not cis. So that was, and I came out to my parents like pretty young, pretty soon after I started realizing that, I wasn't, who they expected me to be. And I expected them to be really supportive, but they weren't. And it's really frustrating as queer and also mentally ill youth, because it's like you need support in order to deal with your mental illness, but if you can't trust your parents to support you in being queer and being trans, how can you expect them to support you in dealing with your mental illness? So I really kept that under the wraps. All throughout high school was a really dark time for me. I was very depressed and suicidal at times, and I never spoke to my parents about it because I didn't feel like I could trust them with my identity at all. I was also from a very rural area, very, very small town, very isolated on an island actually, and I didn't really have much of any, we didn't have like any resources in the surrounding community, either for being mentally ill or for being queer and trans. And then there's also, when I started realizing that I might want to pursue transition and like have my gender recognized, with hormones or whatever, I realized that I had to keep my mental illness even more of a secret, because there's this stereotype or this unfounded belief that trans people who are mentally ill, their transness, and even just like your queerness is directly a result of your mental illness. So I felt like I couldn't, I got a gender therapist going behind my parents' back, and I felt like I couldn't talk to her about anything that was going on in my life because every aspect of my life was so overshadowed by my depression that I would just sit there in silence with her and hope that like when the time came, she'd like sign off for me to be able to start hormones. And so all throughout high school, I really didn't deal with my feelings of feeling super isolated, being super depressed, and being queer and trans. I didn't have anywhere to express any of those feelings. When I came to college, it was really important for me to find a community, which I was able to do, but I felt like when I first came to USC that there wasn't a really big trans community. There was an excellent queer community, but nowhere specifically for trans people. And I found myself feeling really frustrated and isolated yet again, and I actually had a really bad breakdown my freshman year because of it, which is when I started really having to confront the fact that, like, yes, I was mentally ill, I wasn't just, like, sad all the time. And so I had, in moving on from that, I realized how important it was for me to have a community where I could feel valued, like, in spite of and even because of my queerness and my transness, which is why I talked to another friend of mine, and we started the transgender advocacy group. And then kind of moving on from that, like, developing that community has really gone hand in hand with the work on my own mental health that I've done, and I honestly see them as like inextricably linked. And I think that it's that while treatment is super important for mentally ill or just people struggling with mental health who are in the queer and trans community, sometimes I think that community is like as important or even more important than that, in having a safe place where you can like be yourself and let your guard down, because keeping your guard up all the time and dealing with people who aren't being accepting of you is an incredible toll on your mental health.
Thank you for sharing your stories. Let me see. So you, Diego and Ryan, you kind of touched upon it, but how have your personal identities played a role in your activism? Maybe Eli, you can go and more into that.
Okay. Well, growing up in such a small community that didn't have any resources or support for trans youth, I found it incredibly difficult to be out. My parents were not supportive at all for 5 years. I was very lucky that I was able to come out at such a young age, so I wouldn't have to, because when they did become accepting after all that time, I didn't have to go through the wrong puberty and didn't have to experience all of high school presenting a way that I didn't want to. So because this was in 2011, there wasn't any national organization focused specifically on transgender students. I say 2011 because that's when TSCR was co-founded by another young trans activist, Alex Sinella, and myself in, I think I was a junior in high school then, which is really weird saying because it feels like it just happened, but I also feel so old at the same time. So seeing myself represented in activism and in media was something that was definitely new for me starting in high school. I was very lucky that I had access to the internet and was able to reach out to other people and get other trans youth involved. When I was going through elementary and middle school, being forced to that's supposed to mean. My teachers would explicitly pull me aside and tell me I couldn't be a girl. They wouldn't let me play sports or use the restroom. I actually wasn't allowed to use the restroom at school for 6 years. Even when I could, sometimes the teachers would scold me for going to it too often, really meaning they were uncomfortable with a trans woman being in the women's restroom. Or I would have to use the teacher's bathroom in elementary school, which I got teased for, which is really difficult. By fourth grade in elementary school, just a year after coming out, I didn't have any friends, and I became incredibly depressed. It's something that's very hard to talk about, and it's also hard to talk about because being a white trans person, I have so much privilege, and it would have been exponentially more difficult being a trans person of color, who really should be centered in discussions of mental health in the queer and trans communities. Just existing during that time, not even knowing the word transgender, just knowing that I was a girl and I was attracted to multiple genders, and being and having confusion over what my identity was and who I was very tolling on my mental health. And this is something that we're seeing all over the country. 41% of transgender people have attempted suicide. It's a huge number. 80% feel unsafe in school. These are absolutely ridiculous numbers, and they're only very slowly declining. We really need to reach out to more trans people, especially young trans people, and tell them that it's okay and they're not alone, and educate the community as well as the public about trans issues.
Yeah, like I said, for me, it was really growing up inhibiting this double closet where I had to come out as undocumented and I had to come out as LGBT. So for me, that really shaped how I view life. And living in California, knowing that we have so many privileges here, I still understood that there was the Defense of Marriage Act on the national level that defined marriage between a man and a woman. And because of that, if I'm undocumented and I have a partner that's a citizen, they can't sponsor me for citizenship if we're in a same-sex relationship. But someone that's in a heterosexual relationship is able to do that. So growing up and kind of seeing that on the national level, and then having Prop 8 in California happen, I was like, okay, cool. Prop 8 happened, and then it was repealed. Even if I wanted to get married to someone of the same sex, they wouldn't be able to sponsor me for citizenship. But then DOMA was certain provisions of DOMA were struck down. So that's what I ended up doing this year. I finally married my partner, who I was with for a really long time, and in January we got married, and I just became a legal permanent resident last month, which is strange and it's hard to navigate. But for me, I was really pushing toward that. I was like, well, I'm here in California. I want to marry the love of my life, but yet if we were to get married, because I'm undocumented, he's a citizen, and we're in a same-sex relationship, he can't sponsor me for citizenship. So we finally were able to do that, and I experienced a lot of friends who deal with mental health issues. And for me, I was depressed when I was at UCLA, just thinking about the fact that I was at UCLA and I was paying 33% of the money that I was paying into UCLA to be able to be a student. I was paying 33%. It was going to everyone around me, but then it wasn't going back to me because I was undocumented. And I was like, wait, but I'm paying into the same system. Why is it that I can't benefit from it? So now we have the California Dream Act here in the state of California. So there have been so many changes, a lot of advocacy happening around really this movement. So it's like, I'm LGBT and I'm undocumented. I want to get married and I want to be able to be sponsored for citizenship. Okay, I'm at UCLA, I'm LGBT, I want to be able to access resources, and sometimes I want to be able to access free resources. I don't want it to be on a sliding scale because I can't afford it, I can't get a job. So how do I access those services? And really the lack of access. So like I talked about earlier, launched the campaign with Equality California to talk about being undocumented, being LGBT, the reality that there are 265,000 people like me here in the state of California, that if they were to get sick, they can't access healthcare. So a lot of that has been my advocacy, and then working with organizations, like I said, Latino Equality Alliance, opening the first ever LGBT center in Boyle Heights. It's been a really empowering, interesting process, in terms of navigating the legal system and your own identity, and how both of them a lot of times are pit together. So I don't know if y'all remember the conversation that was happening in 2010, where you had the Federal Dream Act attached to the Defense Authorization Bill to be able to fund our armed forces. So to that bill, there was a Federal Dream Act attached, and don't ask, don't tell. So it's just like, okay, you can't put these two things together. It's like my identities are constantly being pinned against one another, and the reality that there is this intersectionality between so many identities. Like, what does it mean to be undocumented, LGBT, Latino, first generation? What does it mean to be a trans person of color, within the API community? So every community has different issues, but there's always intersectionalities, and at the end of the day, understanding that a lot of the issues that we face aren't just in front of us, but that it's a systemic and it's an institutional process that we have to navigate. So for me, I'm all about bringing down systems and institutions that don't really cater to our communities.
I feel like I talked a lot about how my personal life affects my activism. Obviously, with the creation of TAG, I was thinking about creating a space that would cater both to my own personal needs and to the needs of the people who I was meeting through networking and just reaching out, trying to make an effort to reach out to all of the other trans people that I met, and realizing that none of them felt like they had a space that was for themselves. So that was very much the impetus for the creation of TAG. As far as other areas of my personal life where I feel like they really affected my activism, I feel like some of the spaces where I felt most uncomfortable with being trans and with the way other people interacted with my trans identity and my queer identity was ironically in mental health spaces. The first time that, when I had my breakdown freshman year, I tried to seek help, and instead of focusing on the fact that I was dissociating very hard, experiencing a bunch of other symptoms that were super troubling, they decided to zero in on the fact that I wouldn't tell them whether I was a boy or a girl. And so they went down the list of symptoms, asking me what I experienced, and then zeroed in on gender confusion. And I was very much not confused about my gender. I knew what my gender was, and it was neither male nor female. So I said no, but she still seemed really focused on it. It made me uncomfortable, and I actually left and didn't come back, even though I really could have used those services at that time, and had to actually be dragged by someone back over to the health center in order to get the resources that I needed, and I had to request specifically a trans-friendly mental health provider to talk to because I felt so uncomfortable already. I had to wait, even though I was in crisis mode, I had to wait about an hour or so longer than I would have otherwise in order to get somebody who would respect me as a human being. And even so, he was still, it was obvious that he'd had some training, but he still wasn't really comfortable with my trans identity, which was really frustrating for me. It was something that I had to train my own therapist into understanding, and something that I've more or less avoided talking with her about because I don't want that to be incorporated into, I don't want her assumptions about my gender and my sexuality to factor into the fact that I desperately need care in order to manage my mental illness. Then this past year, I was actually institutionalized for about a week because I was in a very bad place. Unfortunately, unfortunately, a large part of it was because of feeling isolated and because of the huge workload that's like placed on students at our lovely university. And once again, going into the institution when I was having my evaluation, they zeroed in on my gender identity. They focused on that in a way that I don't feel was appropriate to focus on it. And once again, I tried to kind of push it aside. But then, despite the fact that all patient medical records should be completely confidential, somehow one of the patients who's in the ward that I was in found out that I was transgender. And in what was supposed to be just a little support group to discuss our experiences, she approached me and singled me out and like asked me invasive questions about being trans, which completely threw me off guard. I was really upset because I was already not in a bad place, and that was the last thing that I needed to happen. I was absolutely furious that the hospital apparently couldn't keep my record secret, but you know, when you're trans or when you're queer, then obviously your identity is for everyone and not just a personal thing. And when I approached the staff to talk about it, they denied knowledge of it, but obviously she knew somehow because it was something that I was absolutely not talking about while I was there, because as far as I was concerned, I was there to deal with my mental health issues and get out, because it's, if you've ever been institutionalized, it's not a super great environment. And then, once again, I was placed in a room with another woman, with a woman, which was fine. I would rather room with a woman than with a man. But after I complained to the administration about the fact that like another patient knew stuff about me that she shouldn't, they offered to put me in a single in order to appease me. Which is something that I feel is super frustrating, is in that the automatic response of institutions, mental health institutions, and also institutions like USC is to deal with trans people by isolating them. That also happened when I first came to USC. Their solution on how to deal with the issue of my housing was to put me in a single, which further contributes to isolation and further contributes to mental health issues. So, yeah.
Thank you. In an ideal world, what would quality services look like as it pertains to the LGBTQ community?
I think something that I would absolutely love to have access to is specifically like LGBT providers for mental health for LGBT people. You know, trans counselors or therapists for people who are dealing with the coming out process, because trying to explain your identity to a cis therapist can be traumatizing in and of itself, which is really frustrating when all you're trying to do is like deal with your own trauma and come to a place of accepting yourself. I think it's especially important to have LGBT crisis counselors for people who are in crisis, because once again, when you're in a place of crisis, not knowing whether or not you can be open about your trans status or status as a non-heterosexual person puts you on guard in a way that you shouldn't have to be on guard in a place that's dedicated to taking care of your mental health. I also just, again, feel like there should be more services and community spaces for trans and non-heterosexual youth in general. super, super, super important, especially for people coming from small towns who don't have access to that. I think having communities, even just online communities, that are safe and centered around creating a comfortable and accepting place, especially for youth, is incredibly important because youth are often like the most isolated members of our community. And unfortunately, with the fact that a lot of the most common community spaces that we have are bars and clubs that are 21 and up, there aren't a lot of spaces for youth to find community with, which leads to them feeling isolated and leads to them not having the services that they need.
I kind of wanted to piggyback on a lot of things that you were saying. There's this organization called Colors. Colors is an LGBT affirmative therapy counseling center that was really in the historic Filipino town area, but then because of various reasons it ended up going back to Antioch University. But that's when you were talking about that, it's like walking into a space where if you're a therapist, like, I know where you're coming from. You don't need to tell me what undocumented is. You don't need to tell me what it means to be queer, to be LGBT. Like, just having someone that understands your lived experience is really powerful and is ready to hear you out and to work through a lot of these issues, because a lot of what happens is that you walk into a space and you have to do a lot of education. I'm like, I'm trying to get some services here. Like, I'm really trying to work through my life, but yet first and foremost I have to do a lot of education. So really, Colors is in the community, and it provides LGBT affirmative therapy. So you don't have to fully explain. This is who I am and this is where I'm coming from. And I give them a training on being undocumented, being LGBT, so they really had an inclusive framework to a lot of their approach with their clients and a lot of that. For me, that's what I would have everywhere. And in the ideal world, I would also have I would have LGBT or queer alliances in every high school. I would have centers like Mi Centro in every community, making sure that all members of our communities have access to resources all the time, where you don't have to travel 2-3 hours on the bus to be able to access resources when you don't have resources. So a lot of it, I think, for me is queer centers, LGBT affirmative therapy, safe spaces out in the community. And what I really wanted to touch on too on the panel is how policy and law really has an impact on how we as individuals live our lives. And so I know AB 1266 really required here in California that a person's gender identity be respected in high schools. So you would be able to engage in programs and activities and be able to use all facilities that match that gender identity. So now there's a conservative group called Privacy for All here in the state of California that completely wants to undo that, and they actually want to introduce, and I have it here in my notes, sorry. Let's see, they want to introduce the Personal Privacy Protection Act. They're talking about if you're in a government building, you have to use a bathroom that's assigned to your biological sex. And if you don't use that bathroom, then you can be sued as an individual, or that government entity can be sued. So even just looking at policy, looking at law, and really they're trying to get it on the ballot so California voters can vote on it. Really what we're talking about is more bullying, more discrimination, a lot more isolation on our high school and college campuses, and really walking into different buildings. So for me, in an ideal world, I would have truly inclusive policy that California can lead to be able to shift the narrative of how LGBT services are provided for LGBT folks. And yeah, I just think we need a lot more LGBT representation within our elected officials as well. So in an ideal world, I would have people who look like me, who have my same experience, making policy that reflects the issues that my community goes through.
Everything they said. No, but really, I want to not necessarily critique, but add on to that law and policy really aren't here to protect us. They weren't here to, it wasn't created for us. In fact, it can actually do a lot of harm to the community. Take gun laws, for example. While they're touted as an end to anti-queer violence, they actually don't do anything to deter violence against queer and trans people, statistically speaking. There's no difference when legislation is introduced. is doubling a sentence going to really like stop someone from committing a crime against a trans person? The answer is no. So being critical of that is really important. Also for things like AB 1266, like Diego was just talking about. I was very involved with that, and it's great that we have that, but at the same time, schools still aren't following it. And just because it's law doesn't mean that cisgender heterosexual people are going to listen. It'd be great if they did. In an ideal world, that would be perfect, but we don't live in that world. So law and policy always needs to be taken with, well, not a grain of salt, more like an iceberg of it. It's very important that we also look at prison abolition as a queer and mental health issue too. Currently, there are more people in prisons than in prisons who have mental illness than there are in mental hospitals. And so this is also very, very critical, and it's been affecting our community as queer and trans people as well, as we are disproportionately targeted by police and imprisoned at incredibly, alarmingly high rates. And this particularly goes for queer and trans people of color who prisons were essentially invented for. Going back to some of Ryan's points as well, just echoing that it's so important that we create a community space where we are able to represent ourselves for mental health issues, having queer and trans professionals treating us who actually know what's going on. There was a really popular hashtag that just went on, hashtag transhealthfail. I don't know if any of you saw it, but it was great. A really popular one was, oh, you broke your knee, must be the hormones. They actually do this. They really, like, doctors and therapists think hormones are the root of all of our problems. And contrary to that, they're just the root of some of them. But it has been a huge issue. Like, something that a lot of people don't know is that the chair of the current version of the DSM, which is what therapists, psychiatrists, and some doctors use to diagnose patients, is a conversion therapist, Kenneth Zucker. He advocates for not allowing any trans youth hormones, says like gender nonconforming youth will never be trans, maybe 1 to 3% of the time. Of course, that counts like he only looks at young people assigned male at birth, so that's counting people who are saying, I'm a girl with boys who like pink. So these statistics are very flawed, and this is what's being used in the DSM, which has been a huge issue. Homosexuality wasn't even removed until 1987, also a big problem. So queerphobia and transphobia are a huge part of our mental health care system. Also echoing off of what Ryan was saying, there are, the majority of researchers on queer and trans people with mental health issues consider their queerness or transness a byproduct of psychosis, which is absolutely ridiculous. There's only been a handful of articles like addressing this and barely any empirical research, and it's really ridiculous when these different marginalized identities get conflated in that way. And this is a huge issue with how we're treated and what documents were being used to be treated with.
I really liked your last point of what you mentioned, because one of the things that we do at work that we focus on is research justice. So making sure that as in our center, we do a lot of undocumented LGBT work or a lot of undocumented work. I'm going to go out and create my own research